Counting pills and capsules seems straightforward enough. However, let's just mention a few pointers that will make the process easier. The first step in filling a prescription is to locate the appropriate drug you will be filling. Be sure the name and concentration both match up, as many bottles appear similar. Pills and capsules should be counted using a counting tray. Most veterinary pharmacies will have one. Pour in the approximate quantity of pills or capsules onto the tray. Use the plastic spatula to slide the pills as you count them into the trough on the end. If you're comfortable counting by twos, you may save time by sliding off pills 2 at a time. Once you have the appropriate number counted, close the lid and return the remaining pills to the bottle. The pills you've just counted can now easily be funneled into the appropriate size pill vial and closed with a child-proof cap. When you know an elderly person without young children will be opening the vial, you may want an easy open lid for their convenience. You may want to assist the client by cutting pills in half when such quantities are prescribed, or demonstrate helpful techniques to the owner to make it easier. There are 2 techniques commonly used in the pharmacy to make pill cutting easier. The first involves the use of a pill cutter. The pill is placed snugly into the V, and the lid is simply closed. The second technique can be performed with any pill that has a slightly bowed surface and is scored, or a line marked through it. Placing the pill on a hard surface and pressing equally on both sides of the score will result in the pill breaking evenly. Providing helpful client services like this are the little things that will make your hospital successful. When filling liquid prescriptions, there are several common measurements that you will need to be familiar with. They are 1 milliliter equals 1 cc or cubic centimeter. 1 teaspoon equals 5 milliliters. This may be helpful if the client is needing to give a teaspoon of medication to their pet. Rather than trying to force a spoon unnaturally into a pet's mouth, a 5 or 6 cc syringe can be used without the needle to squirt 5 cc's or 1 teaspoon of the medicine into the corner of the dog's mouth. 1 tablespoon equals 15 milliliters or 3 teaspoons. 1 ounce equals 30 cc's. This is helpful when the total amount of liquid being dispensed is sufficiently great enough to require putting it into a small bottle. Bottles are often classified by how many ounces they hold. A small bottle may hold a ½ ounce, and a large bottle may hold 16 ounces. Certain products require the addition of water to reconstitute a medication. The label will indicate how much water to add. You will often use tap water with oral medications and sterile water from a bottle for reconstituting injectable products. Always be sure and follow the directions on the label. After the medication has been filled and properly labeled, double-check to be sure that the directions and medication both correspond with the doctor's original prescription. All medications dispensed should be verbally explained to the owner by the doctor or someone on the staff. We will conclude this section on practical pharmacy skills with a brief discussion of controlled substances. You'll recall that over-the-counter drugs do not require a doctor's consent or prescription because of the drug's relative safety. Prescription drugs are those drugs that require a doctor consent because of their danger if not properly used. There is a class of prescription drugs that have a high abuse potential in people that we call controlled substances. As the name implies, these drugs are under stiffer legal controls so as not to let them end up in the wrong hands. They are controlled by an agency of the U.S. Department of Justice called the DEA, or Drug Enforcement Administration. This agency has established additional rules and paperwork that helps prevent the illegal acquisition of these drugs. In order for doctors to acquire and dispense controlled substances, they must first register with the DEA. The doctor must maintain accurate records of all controlled substances purchased and dispensed. This creates a system for the DEA to track each bottle of controlled substance from the manufacturer all the way to the end user. These records are regularly inspected by the DEA and must be maintained with 100% accuracy. The primary location for this documentation, besides the medical records, is the Controlled Substance Logbook. Here is where each controlled drug is listed upon arrival. When any patient receives or is dispensed a controlled substance, the patient information, along with the amount given, is recorded in the logbook. This log should demonstrate exactly how much of each controlled substance is on hand at any given time. It is highly recommended that when assisting the doctor in dispensing controlled substances, that the information is logged at that time rather than later in the day. Controlled drugs and their acquisition invoices must, by law, be stored in a substantially constructed cabinet or safe. It is required that the cabinet be securely locked with only a few people possessing the key or combination. Let's look a little closer at the drugs we call controlled substances. They're broken down further into 5 groups or schedules based on their addictive qualities. The most addictive of these we call Schedule I drugs. These are highly addictive drugs that have no accepted medical use and therefore are not found in veterinary hospitals. Examples of such drugs would be heroin and LSD. Schedule II drugs, like Schedule I drugs, lead to severe chemical dependence or abuse. This class of drugs, however, has a clear medical purpose. Morphine, meperidine, and pentobarbital are 3 examples of Schedule II drugs one might find in a veterinary hospital. Newer and safer drugs have allowed many veterinarians the advantage of not having to stock such abusive drugs in their hospitals. As we progress down through the 5 schedules of drugs, we are progressively dealing with less and less addictive agents. Schedule III drugs usually contain small amounts of stimulants and narcotics mixed with other drugs. An example of a Schedule III drug is Buthanasia D. This rates a Schedule III because the pentobarbital is mixed with phenytoin, reducing its abusive potential. Schedule IV drugs are even less addictive. Valium is the classic example of a Schedule IV drug. And finally, we get to Schedule V drugs. Cough syrups that contain small amounts of codeine receive this rating. Scheduled drugs are labeled with a capital C, followed by the numeric code of that schedule. Remember, all of the scheduled drugs must remain under lock and key and must be thoroughly documented in the logbook. When a scheduled drug is scripted from a local pharmacy, the doctor uses a special triplicate prescription pad that is provided by the DEA for just this purpose. A triplicate order form is also required when ordering Schedule II drugs from the manufacturer or distributor. All of these invoices and logbooks must be stored for at least 2 years beyond the date they were dispensed. Many of these controlled substances, when properly used or dispensed by the veterinarian, have an irreplaceable value in the health and well-being of our animal friends. But let's all practice the steps we've talked about to keep the drugs where they belong. This concludes our discussion on controlled substances and the pharmacy skills necessary to properly understand and fill veterinary prescriptions.